Did you know humans sleep an average of 122 days a year? This is nearly half the year spent in bed. However, the difference between sleep and great sleep is huge. So today we will talk about how to get a better night's rest. My name is Maria Hamill and I am the Learning Programs Coordinator with Veterans Upward Bound. If you have any questions or concerns or want to talk about any workshops, please feel free to contact me. I will make sure that you have my email in the email of this workshop. So today we'll go over why sleep is important, different sleep disruptors, tips for a better night's sleep, and then some resources for getting better sleep. So why is sleep important? Sleep is important because the body needs sleep to heal itself. During that time, your body will heal everything that it has done to itself throughout the day. So a good night's sleep is really just as important as eating right and exercising. Not getting enough sleep can affect many areas of the body, and honestly, it's the overall health of the body. But today we're going to focus on 4 of those and breaking those down on how it affects, not enough sleep affects your body through the heart, lungs, brain, and digestive system. So starting off with the heart, not getting enough sleep or short sleep deprivation is associated with higher blood pressure and an increased risk of heart disease. For the lungs, sleep deprivation can weaken your immune system, making you more vulnerable to respiratory infections. For the brain, insufficient sleep can lead to lower brain performance and slowed reaction time. And as you know, slowed reaction time can affect many areas of your life, maybe driving, at work, and it can have costly side effects. And lastly, for the digestive system, sleep deprivation can affect the chemicals that signal your brain that you are full. So as a result, you're more likely to eat more when you've had enough to eat. In turn, this could lead to obesity. And for the average adult, it is recommended to get 7 to 9 hours of uninterrupted sleep per night. And I also want to mention that the circadian rhythm also has an important part in your sleep and getting enough sleep. So the circadian rhythm is part of your body's internal clock. So your brain is telling your body it's time to sleep and when it's time to be awake. And circadian rhythm is super sensitive to environmental factors such as light. So this is why the body aligns itself with the sunrise, meaning your brain tells itself it's time to be awake, the sun is out, and then it also indicates when the sun is set, your brain is telling your body, hey, it's time to be asleep, the sun is gone. So long-term disruptions of your circadian rhythm can cause issues with your sleep, and we'll go through those today. Next up is sleep disruptors. So today we're going to talk about a few of sleep disruptors that can affect your quality of sleep and getting enough sleep, which include alcohol and drugs, caffeine, irregular sleep schedules, any medical issues or illnesses, and negative emotional states. Research suggests that drinking alcohol or using drugs to help you fall asleep can disrupt the body's self-regulating mechanism. So continued use for alcohol and drugs to go to bed can affect your body's self-regulating mechanism in the future, and that it might be depleted. And drinking caffeine to wake you up in the morning and to stay alert can definitely help, but drinking caffeine late in the day can keep you up at night because that caffeine is pumping through your body. It's suggested to limit your caffeine intake after noon. Irregular sleep schedules, such as sleeping late on the weekends, taking long naps during the day, or rotating shifts for work can disrupt your sleep-wake cycle. It's really important to keep as consistent of a schedule as possible. Medical issues and illnesses, such as use of medications, chronic pain, depression, PTSD, can have effects on your sleep. And we'll go over today with all of these sleep disruptors of how to work around that. Lastly, negative thoughts definitely have some effects on sleep. And there are two different types of negative thoughts. There are the short-term negative emotional states, so maybe like a current stressful event or recent loss that you're losing sleep over. And there's also long-term chronic emotions, maybe such as like PTSD, that have more severe conditions and that require medical attention. So all of these sleep disruptions we want to try to definitely avoid. However, I am cognizant that some of these are not easy to avoid, and we may all have issues with them. So next we're going to go over some tools on how to manage these disruptions. All right, so here are some tips to get some better sleep. Making sure that you increase your light exposure during the day is important. Getting enough light exposure during the day helps regulate and keep the circadian rhythm healthy. We talked about the circadian rhythm a few slides ago here. So getting enough bright light during the day tells the body that, hey, the light is out, it's not time to sleep yet. And when it comes time to sleep, your body will naturally correlate to it being dark equaling sleep time. Turning off electronics before bed is also important. This kind of goes along with that light exposure during the day. So if you're trying to go to sleep with the TV on or you're looking at your phone before bedtime, this can signal to your brain to think, hey, the light is out, it's not bedtime yet. So keeping your room dark can promote better sleep, and putting your phone away maybe an hour or two before going to bed can be helpful for this. We talked about, oops, wrong slide. Okay. Making sure that you limit your caffeine late in the day is also important. Consuming caffeine late in the day alerts your nervous system to say, hey, it's time to be awake, let's get things done. But studies find that caffeine can stay in your bloodstream to up to 6 to 8 hours. So consuming caffeine after 3 to 4 p.m. can affect your sleep quality. Thought that was really interesting that caffeine can stay in your bloodstream for 6 to 8 hours. I did not know that, and definitely makes you think, how much caffeine you're consuming throughout the day. If you're lucky enough to get a nap in during the day, which would be awesome, you should make sure that your nap is no longer than 30 minutes per day. Anything after 30 minutes can disrupt your sleep patterns because you're typically falling into a deeper sleep after 30 minutes. So studies show that taking a 20-minute power nap is effective in increasing your alertness and your focus. Of course, this depends on the individual, but taking a 20-minute power nap is suggested. We talked about this earlier, but limiting your alcohol intake is important before going to bed. After consuming alcohol, your body will awaken once the alcohol has been digested, and this typically happens after 4 hours of consumption. So let's say you're going to bed at midnight. Typically at 4 a.m., you might wake up because that alcohol has been digested. And once you are awake, people often have issues going back to bed. Keeping a consistent sleep schedule can help with your body's circadian rhythm and keeping on track. However, I do want to be cognizant that this can be hard to do with alternating work schedules. That's something that maybe you can't get around. But trying to keep your sleep schedule as consistent as possible will help you feel better and more refreshed in the long run. So let's say if you wake up during the weekdays at 8 a.m. And you might want to think about waking up at 9 a.m. on the weekends, let's say. Just sleeping just a little bit, but trying to keep your sleep schedule as consistent as possible and close to the time periods as possible. Also, considering your sleep environment is important. Your bedroom should be dark, quiet, and cool. And you should, to the best of your ability, use your room or your bedroom for sleeping purposes only. This is In this way, your brain and your body associate the bedroom to sleep. And studies show that keeping the temperature of your room while you're sleeping to around 70 degrees is preferred to a great night's rest. Studies show that eating snacks in less than 4 hours before going to bed can disrupt your sleep, and specifically the hormones, including melatonin. And melatonin is the hormone in your body that tells your brain that you're sleepy and you need to stay asleep. So it is suggested to try not to snack 4 hours before you go to bed. However, if you're like me, this is hard to do, but this is what the studies show. It is no surprise that exercise is a really great tool in aiding sleep. Performing regular exercise tires your body out, thus helping you fall asleep faster and stay asleep because your body's saying, hey, I'm really tired from all of the activity we just did. I need time to heal. Kind of like how we talked earlier about how the body needs sleep to be able to heal all the things that were disrupted throughout the day. However, I want to be mindful not to exercise too late in the day before going to bed, because if you're exercising too late in the day, this can hinder your ability to sleep due to the fact that the body produces adrenaline during exercise, and adrenaline is the bodily hormone that causes you to stay alert. Lastly, if you are struggling with your sleep and it's a consistent problem throughout your life, it is important to consult your doctor considering this. There could be other underlying issues going on, such as insomnia or sleep apnea, that you'll want to talk to your healthcare provider about. I found this really cool resource through the VA that is helping folks with their sleep and helping stay asleep. And it has lots of different resources. I'll make sure that I have this link in the email of this workshop. So on this page, you'll be able to see how to set a consistent sleep schedule, maybe taking a look at your sleep behaviors and seeing if you can modify anything to help you stay asleep and get to sleep. I also want to point out here that there is this cool resource called a sleep diary. And this is to help promote better sleep, and it is a way of tracking your sleep and maybe your naps, to see how you feel after you wake up, the time you went to bed, the time you woke up, and different things that maybe you can see how they're affecting your sleep and how maybe you can adjust them. So, super cool resource. I'll make sure that I have this link in the email of the workshop. Thank you. I hope this was helpful, and I don't know about you, but I learned a lot about sleep today, and there's a lot of cool resources as well when it comes to sleep. If you have any questions or concerns, please feel free to reach out to us at our email or our phone number and take a look at our website as well. Thank you, and I look forward to hearing from you and seeing you at the next workshop.